hope you and your families are safe and healthy. We want to take some time and update you on some of the current changes to our normal workday routines based on the COVID-19 pandemic and the governor's stay-at-home order. We have asked all employees to fill out a COVID-19 questionnaire daily. We have placed COVID-19 specific signage throughout our campus and job sites. We have separated our shops with dividers. We have propped open many of our interior doors throughout our campus. We will continue to do our part in providing information, installing guidelines as required, and providing updates as appropriate. Please maintain your focus and stay safe. Be safe.
Be sure to maintain adequate social distancing. Maintain at least a 6-foot clearance between you and your nearest neighbor. If you can't maintain the 6-foot clearance, be sure you're wearing a surgical mask and proper disposable gloves. Think of instances where you will be in elevators, or on break, or where you can't maintain that adequate distance. For those of you walking into hospitals or active COVID treatment facilities, first of all, thank you. The first thing you should do before walking into one of these facilities is wear at least a surgical mask, or what's preferred, an N95 mask. Keep in mind the N95 masks are fully washable and can be reused multiple times using proper cleaning techniques. And please, under no circumstances should any employee go into an active COVID patient area, as that requires additional PPE and training. And please remember to always follow the facility's minimum requirements. Under no circumstances should any employee go into a space with active COVID patients, as this requires additional PPE and training.
At the Hill Group, we're doing everything possible to protect our employees, protect our job sites, protect our shops. We've had to make changes to our response plans. Following CDC guidelines is a new thing for all of us. So understanding what that means for our shops, our field, our job sites, our customers. So we've had to make changes to some of our protocols, some of the things that we follow daily, and make adjustments based on the changing and the dynamic environment we're in right now. We're doing everything we can to protect people and to protect our office and our employees. So part of that is changing some of our protocol, changing our work from home policies, making modifications in our shop and how people work and how they interact with each other. So all of these things we're doing at Hill as far as changing our PPE on job sites so that to respond to this environment. We're doing all these things to protect our employees, but beyond that, we're doing that to protect our customers and our jobs and protect those we work with.
While we work through this COVID-19 pandemic, please don't risk your health and well-being, as well as the health and well-being of your coworkers. If you're sick, stay at home. Know the signs and symptoms according to the CDC. These could include a temperature of 100.4 or greater, a dry cough, or shortness of breath. Understand that older adults, 65 years and older, or those with severe underlying medical conditions are at greater risk. These include heart disease, lung disease, or kidney disease, as well as diabetes. Be aware of how you cough, sneeze, touch surfaces, or gather with others, both on the job and off the job. Let's respect each other and follow the guidelines established by the CDC as well as Hill. Ours is essential work. However, don't forget that you have the right obligation to stop work if you don't feel comfortable. Working together, using good common sense, will get us through this pandemic. Thanks for your cooperation.